So good evening, everyone. I know most of you, I think, but for those of you who don't know me, I'm Sarah Bleich. I'm an assistant professor in the Department of Health Policy and Management. This is the second annual HPM alumni panel, so welcome all of you. I'm glad you could be here. I'll tell you that when I was a graduate student, I'm about 3 years out now, but when I was a graduate student, this type of panel, sort of learning people on the market or recently on the market, was a huge help. So I hope that you'll engage with the panelists, talk to them during the cocktail hour, and this is going to be in two parts. So the first part will be about an hour, 50 minutes. Each panelist talk for about 5 minutes about their job market experiences, their life after graduation, things they learned, things they didn't learn, sort of give you some advice about some things that for them were really helpful, either in their current jobs or when they were on the market. And then for the second hour, it's a cocktail hour, and you can network, you can chat with the panelists, talk about their experiences, and I'll tell you, and you'll probably hear this from the panel, that networking can be a key way to get jobs. So please stay and chat and talk with each other and the panelists and get some advice that they may have for you. And I'm going to introduce each one of them in alphabetical order. It's not the order that they're sitting in, just so you have a sense of who they are and where they're coming from. So Mark, if you could raise your hand. The first is Mark Biddle. He has 20 years of health management experience. He's currently the Vice President of Ambulatory Services at Johns Hopkins Medicine. He's the Director of Ambulatory Quality and Patient Safety at the Johns Hopkins Health System. He has experience leading numerous performance improvement teams and especially interested in patient identification, care delivery model innovation, and creating sustainable improvement. He's currently on faculty at the Bloomberg School and Carey Business and teaches 2 classes, one on management and organizational behavior and the other on health services administration. He's also a pilot. And his degree from HPM is a Dr. PH. Cyrus, if you can raise your hand. Cyrus, engineer. He currently works for the World Health Organization in their patient safety program. He led the Save Lives, Clean Your Hands initiative that aimed to heighten awareness of hand hygiene among healthcare professionals globally. He serves as faculty and co-teaches a course on patient safety here at the school. And he's also the manager of WHO's Patient Safety Project at the School of Medicine here at Hopkins. And he received both his master's and his Dr. PH from HPM. Marjorie Innocent. She's the senior director of research and programs at the Congressional Black Caucus Foundation, which is located in DC. She leads development, implementation, and evaluation of the Foundation's initiatives in health, education, economic development, and leadership. She serves on the Health Equity Leadership Commission of the Congressional Black Caucus Health Brain Trust, the advisory board of the Robert Wood Johnson Foundation to prevent childhood obesity, and the planning committee for the annual National Conference on Health Disparities, which is led out of the University of South Carolina. Her PhD comes from HPM. Lydia, a friend and colleague. She's an assistant professor, a recent graduate, of community health education at Hunter College, which is part of the CUNY system in New York. They have a new school of public health there. She teaches a class on community health assessment and social disparities in health. Her research interests include translating research into practice and policy, racial and ethnic health disparities, the social determinants of health, and the neighborhood environment and its role in health promotion. Lydia received her master's and doctoral degree from HPM.
Nope, not master's.
Not master's. Oh, right, master's from Harvard, doctoral degree from HPM. Thank you. Joanna Zabloski-Kufel. She is a recent graduate, food safety fellow in the Food Safety and Inspection Service at the USDA, with a focus on public health performance and management. She's been involved in several federal-wide initiatives like Healthy People 2020, which many of you have probably heard of, President Obama's Food Safety Working Group, and she just graduated, and her dissertation focused on the relationship between Maryland's local environmental health and food protection infrastructure and foodborne illness. She got her MPH in environmental health here at the school and her PhD from the Department of HPM. So let me turn it over to Joanna, who will start things off. I've asked each of them to talk for about 5 minutes, and then we'll open up for questions. I forgot one person. Oh my goodness, I'm sorry. I'm sorry. And last but not least, and I'll be quick now in the interest of time, is Whitney Witt, who is an assistant professor in the Department of Population Health Sciences at the School of Medicine and Public Health at the University of Wisconsin at Madison. So I'll keep that brief so we can move forward. So, Joanna.
Hi, my name is Joanna. I graduated in, I'll start even further back. I had no interest in public health when I graduated, or when I started college. I'll start that far back. And took classes in community health as I was going along and had some interest in public health as a result of that. Worked for a couple years in Boston doing some breast cancer research and decided that a degree in public health would be probably the best way to go given what I had experienced and what I enjoyed doing in Boston. So applied here, got in here, and then did a dual, at the time that I did my MPH here, you could have concentrations, they called them. And so I had my concentration in environmental health sciences, but also in health policy and management. And that's where I met Dr. Tom Burke and Mary Fox and Beth Resnick over in HPM, and got a lot of experience working with local health departments and understanding, particularly in environmental health, how they do what they do, what their resources are, how they're organized, how they're structured, and how effectively they can or they cannot do what they're asked to do by regulation or by statute. That led, with some prodding from Dr. Burke, to apply and get into the PhD program in health policy and management. And I continued essentially to do the very same thing, except to narrow my focus to food, particularly. So I started interviewing and speaking with a lot of local environmental health directors here in Maryland. There are 24 counties in the state. I talked to all of them, and I interviewed all of them. And that kind of developed into a dissertation project, actually quite naturally, which was kind of nice, where I already knew the population I wanted to survey and wanted to be involved with. And so I actually I knew all the people that I needed to get data from, which was kind of nice at the time. In that period, I also met Dr. Erin Dreiling, who is also a graduate of the HPM PhD program. And she was working at the Department of Agriculture and the Food Safety Inspection Service, and mentioned as I was getting close to being finished that there might be a position open and that I should, touch base with her. And I was looking for jobs, and one of the first people I called was Erin, because it was within the realm of what I was doing. I'd only really been focused on local and state food protection, and this was an opportunity to learn something and completely new. And she actually had a position held for me that was a food safety, well, it wasn't held for me, but it was a food, that sounds a little bit much, but it was a position that existed at the USDA level, or at the the Food Safety Inspection Service level, that each individual department could elect to hire a employee, but they were technically a food safety fellow, which meant that they could cover a wide variety of topics for the department, for that individual department. And they would be kind of there for 2 to 3 years, and everyone had a different sort of training background, and it was a natural fit for me. And so that's how I came into Food Safety Inspection Service. It's been an interesting experience. It is very different than academia. It's exceptionally more political than I ever thought it would be, which is good and bad. But I was honored and really blessed to be taken sort of at a fast track level, and got introduced to a lot of the key leadership positions within the agency, and have now been able to brief all of them, write reports for them, prepare documents for them, and I now sort of am, fortunately or unfortunately, the go-to person for a lot of the major initiatives within the agency, within the Food Safety Inspection Service, namely Healthy People 2020 and the President's Food Safety Working Group, which are kind of highly known initiatives that, and again, I didn't realize quite how political decisions around those options or around those activities were. And so it's been a great learning experience, and I'd be happy to talk to anyone about it in the future. No, sorry.
Hi. Thank you for inviting me to be here. It's really great to be back. I feel like I'm at home here for many reasons. I've never been in this room, though. This is a new space. This wasn't here when I was here in 1999. So I am going to talk to you about my experience as an assistant professor of population health in the School of Medicine and Public Health at the University of Wisconsin in Madison. And my remarks are going to be based on just my experience and what I think has been most helpful for me coming out of this program in my current job, and the things that I thought, that helped me with going on the job market. So my current job really encompasses 3 different roles. So it's primarily, I'm a researcher. It's kind of like juggling 5 dissertations at the same time. I'm a PI of several different studies and lead a research team. And that's been amazing. And I think the things that I did while I was a doctoral student that really helped prepare me for that part of my current job are things like getting involved with professors' research projects. So in addition to obviously doing my dissertation, I got involved in a research project with Dr. Starfield and Riley. And we ended up doing a study looking at social class gradients in adolescence, and ended up writing a paper and publishing it. And so that was a really amazing experience while I was here that I think really helped prepare me for my job as an assistant professor. The other part of my current job involves teaching and mentoring. And another aspect of what I did while I was here that I think really helped me in preparing for that part of my job was to TA. I think a lot of students tended, I don't know if this is true, but they tended to shy away from that experience. And I would really encourage you to do it. I think it's a great experience. I found that when I went on the job market, it really set me apart because I had been teaching, and I had revamped a course, so I TA'd for 2 years, and I could say that I was part of redoing an entire course. I taught the Intro to Health Services Research class with Ann Riley. So that, I think, if you have the opportunity to do that, I would really encourage you to think carefully about that. The third part of my job right now involves service to the university and to the department. One of the things that I did while I was here as a student was to get involved in serving the community. So getting involved in working on committees, understanding governance from a student perspective, but it also gives you insight into what it would be like as a faculty member. Because if you decide to go the route of academics, you will be expected to serve, the community and grade qualifying exams and admit people and things like that. And it is important to know how that works. So I'd encourage you to do that as well. So I graduated in 2001, and after I left here, I went and did a postdoc at the Harvard School of Medicine in Pediatric Health Services Research. And I was just mentioning to Sarah that was a really important time for me because it really allowed me to publish my dissertation, get my job talk ready, and really position myself very well for going on the job market. So I thought that was a really important time to just sort of take a breath, recover from the dissertation, publish it, and then get ready to go and do job talks. The other thing that I would like to sort of mention is, during my doctoral program and in my postdoc, I spent a lot of time going to conferences. And at the time, I felt like this is great because it helps me keep my work going. I submit abstracts and then I go present it and get feedback. But at the same time, I don't know if I really realized it at the time, I was forming a network of people that would eventually become the people that helped me get jobs. So the jobs that I've had in my career, I've never gotten through answering an ad in a newspaper. I've never gotten through any kind of advertisement. It's all been networking. So I would encourage you to find a professional society like Academy Health or APHA or some other society that links in with your interests, and really start to spend some time with your colleagues and get to know them. These are the people that are going to be looking for you to join them in their departments. So I think that was also something that was really, really important. I think those are my remarks for now. So. Take this one, sure.
Good evening. It's a pleasure to be here. I must confess this is my second time, so I don't know if this is going to be a permanent position for me, but I enjoyed it last year and so accepted it gladly when this opportunity came my way. So I don't know where to start because my colleague here covered almost all the bases in terms of what is important, but I'll share. I've sort of been in a lot of domains in healthcare, started out in the pharma industry and then stumbled into hospitals and was an administrator, and then decided I wanted to go into academia, worked at Hopkins, and finally decided to go to WHO. So I work for WHO for the Patient Safety Program. It is embedded in a cluster called the Information Evidence Research Cluster. The first 2 years I was based in Geneva, deputed from here to oversee a global campaign on hand hygiene. It was quite a learning experience there, and I would say that it was, I mean, some of the things that I think I cherish was the learning that I got during my coursework here, and how some teachers insisted, my advisor particularly suggested that I take up some courses, and which I sort of was at one point in time, why? Why do I need to take these courses? I don't foresee the need to take some of these courses. And surprisingly, some of these courses which you just mentioned, the health services research course and the quantitative tools for managers and biostatistics and EPI, we managers shy away from, I'm speaking for myself, but a lot of managers too, shy away from some of these courses, you know, the 621 series. Why can't I take the 611 series, you know? And so I asked that question probably a half a dozen, if not more times to my advisor. But I think, you know, walking away from school, those things have really helped me understand how we, you know, plan for designs, how do we make sure that we collect good data, design the study and the population at risk and so on and so forth. So work at WHO has been interesting, and so at some point in time I miss the close contact that I had with customers, because our customers or stakeholders are 194 member nations who are across the globe, and so you do deal mostly with countries and ministries of health. And so you're sort of away from operations, which is like in a hospital, but all in all, it has been quite an enlightening experience at WHO. Now I'm at Hopkins in a new office that has been set up for WHO, so I work out of Baltimore, which is where my family is, and well, we're doing some work jointly in Hopkins and WHO on evaluation. I'd be happy to talk more about it later. Essentially, what I think are skills that you need to prepare yourself, and I cannot emphasize more about the aspects of networking, the importance of meeting people, going to journal clubs, making friends and groups, and you know, in my time we didn't have Facebook, my time, but you have that now, and there's lots of ways that you can network. You don't have to be physically present, and so it's important to be in touch with your peers, go to these. You know, one of the things that I think was most interesting was to, when you walked into an elevator at Hopkins at the School of Public Health, you would almost always find, you know, notices that invite you to attend one or two brown bag lunches or seminars, and these were, sometimes you might think, oh, okay, this is not my area of interest, but guess what? You might meet some interesting people, so don't just focus on the topic as much as, you know, the ability to network and get to meet new people. So with that, I think I will leave some aspects to the rest of my colleagues here on the panel. Thank you.
Okay, let's see if I need this. I'm kind of loud in general. Most people know that about me. I'm from New York, so I talk fast and I'm loud. So if I talk too fast, give me a signal and I'll slow down. So I think on this panel, I'm actually the most recent grad, because Joanna was March and I was August of '09. So, and we were the same cohort. And so I'm going to ditto everything that Whitney said about academia, since I'm actually in academia. So I'm assistant professor at the City University of New York, the new School of Public Health, which should be accredited in a month, hopefully. Our site visit is December 15th, so it's a little stressful right now trying to get a new School of Public Health on the ground. But one thing to say is that public health has actually become a very big cachet, and so you have these new schools of public health that are cropping up everywhere. And so for people who are getting PhDs in public health, they need faculty. And we still need faculty, so just think about that as you're going around. And not only, even if you're an MPH student, there's also adjunct teaching, so you may not be on faculty as a full-time faculty, but you could get the teaching experience. And so I just want to throw that out there in terms of that. So I'm going to try to be a little different and just talk about a little bit about my path, and as being the most recent to go on the job market and in this job market. So I went on the job market in, I would say, the fall of 2008. Yeah? Yeah. Which is interesting because my dissertation wasn't even close to being written at that point, but I finished it when I needed to finish it. So, and one of the things that my advisor and I had struggled, and my advisor was Dr. Thomas Levis, always struggled with was, I don't really know if I want to do academia. And he's like, okay, but you're getting a PhD. And people who get PhDs kind of go into academia. So it was a huge struggle for me. I really didn't know what it is that I wanted to do. And I actually did something that scared, where's Judy? Judy Hoser a little bit, and my advisor is I actually took a year off after my orals and worked for the Maryland State Health Department. And I actually was the special assistant to the Secretary of Health for the state. And so I did that for a year, which was really interesting because I wasn't sure. I was like, I don't want to go in academia. I'm published in Paris. It's not for me. I'm not that good at it. At the stage you were at Hopkins when you just feel like you can't do anything. And so I was like, I'm going to go and work for government, and I'm going to figure out if government's the way for me. And maybe when I finish this PhD, then I'll get a job in government. And so I worked for the state for a year. It was a very, echoing Joanna, very political process, which I did not realize as much until you're right in front of it. I was lucky. I was working for the top man in the state health department, who is, actually an MPH graduate of Hopkins and is, really bright, really gets it, all this kind of stuff. And I just kind of sat there like, whoa, okay, maybe not. And so, but it was the best experience of my life. And so, so that Judy doesn't freak out, I'm not recommending everybody take a year off. But it worked for me, and it was really one of those great experiences of just kind of also figuring out. That was a time, and in a way, it worked for me because it was a time to figure out, okay, well, maybe at this stage in my life, government is not what I want to do. Before I finished a PhD and decided to, for example, get a federal job and feel somewhat, to some extent, not saying that she is, stuck. Because after you're done, it was kind of good. I was like, okay, I can go finish my PhD and then decide what I want to do. So, but even in the job market, I actually still applied for federal jobs. I applied for state jobs. I applied for consulting jobs. So I really ran the gamut of what I applied for because I wasn't too sure what I wanted to do. I was lucky enough that because CUNY is starting this new school of public health, they had like 9 jobs available in the spring of when I applied. So it's, for anybody who doesn't know, it's a consortial school. It's actually made up of 4 schools. So I'm at Hunter College, but it's Hunter College, Brooklyn College, Lehman College in the Bronx, and the Graduate Center, which is what gives out the Doctor of Public Health degree. Each one of those, except for the Graduate Center, had a job, and had a job in the area that I was looking at. And I actually applied for all 3 jobs, interviewed for all 3 jobs, got all 3 jobs, which was a very interesting kind of thing. And the reason why I'm saying it is that one of the things I actually will say as a friend, Sarah kind of helped me through this process when I was going through it, is that sometimes through this dissertation process, you kind of feel beat down and you kind of feel like, I'm dumb, I can't do this, this is crazy. And then you realize that, you know what, you're coming from Hopkins. And you have skills that you do not believe that you have. And they're skills that are wanted. I applied for all those jobs not thinking I was going to get interviewed at all of them, not thinking I was going to get all of them. I was just trying to get a job, I'm going to be honest. So I put 10 resumes to 10 different faculty positions out there and got half of them. And then had to make this crazy decision about where am I going to go, and especially within the CUNY system, within the same system. So which school am I going to pick? I picked the one I picked for actually political reasons. But it was a good choice, and I particularly wanted to go back to New York, so I also kind of focused my search in New York. Not saying you have to do that, but that's the way to go. And unlike Whitney, I actually didn't do a postdoc, which we can both talk about the advantages and disadvantages. I think there are advantages to getting a postdoc because, for example, she got her dissertation papers published. I'm still working on publishing mine because I'm at a teaching university, and I do a lot of teaching. I do more teaching than let's just say I do a lot of teaching. I do more teaching than research right now, which, that will change, but, I'm the new one, I'm the low one on the totem pole, so, I'm teaching all the intro classes, and that's what I'm doing. So, there's advantages and the disadvantages to that, Postdocs, depending on the postdocs you get, don't really pay a lot of money, especially in New York City. So I actually did, I'm not lying. I did get a postdoc in New York City, and I was like, I can't live in New York City on this money, so I took the full-time faculty job. And so, you have to kind of think about where is it you want to be, how is it that you want to do it. You know, I got to admit, I'm still juggling if academia is for me. I'm in academia right now, but, you know, all of us on this panel, all of us, are fairly young. And so what? I decide if it's for me as I'm doing it. I keep on going and see if it's for me, and if it's not, then I move on. You're young. We're all young. So, anyway, so we're going to move on to the next person.
Before I get any older. So I'm going to approach this a little bit differently, just to give you a sense for kind of how I've progressed through my career, and how that wound up with me getting a doctorate in public health from the school, which is probably, aside from my family, the best thing I've ever done, certainly for my career, but I think for me personally. I pretty much knew I wanted to be in healthcare from the time I went to undergrad. I thought I was going to be a doctor, but I realized I just didn't want to work that hard. So I decided to take a different track. I really liked administration. I liked running things. I kind of figured that out while I was undergrad. So I actually, when I graduated from University of Maryland, I started working here at Hopkins in the emergency department as a financial manager. So I was basically running the budget. And as it turned out, the manager was retiring. So he actually postponed his retirement until I was able to graduate and start. And ultimately, I took his job. So that was my first job out of college, was as a manager. And I sort of fell in love with it. I really enjoy working with people, and I like working with people to get things done. I knew I needed a master's degree to really progress through the ranks of hospital administration. So I actually went back to school at night, got my master's degree at night. I think one of the things that I encourage people to at least think about if you have the opportunity is to not necessarily go right from undergrad to grad school and kind of do it you know, from a day perspective, but to really consider whether you have the opportunity to get a job and do your schooling at the same time. For me, at least, it was remarkable how I was able to go to school at night till 11 o'clock, come back the next day, and actually apply what I just learned. And for me, that was the greatest reinforcement that I could have as to why I was investing all this time in school. So it really benefited me, although it took me 4 years to get my master's degree. So I knew, again, that I wanted to be in health systems. I wanted to continue to work in larger health systems. I worked in a number of the large ones around here, Penn, Maryland, Hopkins, on several occasions. But it was 13 years later that I decided to go back to school and get my doctorate. And I always knew that I wanted my doctorate. Part of the reason I wanted it was because I figured when I retire, when I'm old, that I could teach, because I really enjoy teaching. And I thought it would really help me to sort of position myself. I could start doing some teaching along the way. And ultimately, when it came time to retire, that would be my part-time job. But as I got into it, I began to realize that it was really something that was going to be beneficial to me from a health system perspective. When I decided to get my MBA, as opposed to an MHA, which everybody was doing back in the early 80s if you were in healthcare, I said, I think that really the trend is going to be more towards business. People are going to want to run these like businesses. They're going to need to understand the business side of things as much as the healthcare side. So I kind of was the oddball and went and got my MBA with a healthcare concentration. When I started to look at doctoral programs, I was thinking the SCD, PhD, but when I really started to think about it, and Laura Marlock, helping me to think through it, she said, the program that you really want is the DRPH in Health Policy Management. And again, it was the best decision that she ever made for me, because it really has helped me tremendously as healthcare has begun to evolve now to a much more community focus, accountable care, all the things that you hear about with health reform. My interest has always been in the ambulatory environment, so I've pretty much, with the exception of a few stints doing multi-organ transplant programs and such, I've really been ambulatory-oriented, ambulatory-focused, work with physician practices a lot. My big interest is around community health care and how do we link the resources of a health system like Hopkins to the community resources that are out there to better deliver care. I've been involved a lot, and I think it's something that everybody should consider, back to the volunteering issues, but get involved in both local organizations, but also state and national. I think some of the best experiences that I've gotten in terms of expanding my mindset on a lot of things has been related to the fact that I participate a lot at the national level, both at the University Health Systems Consortium. So these are as a consortium of academic medical centers. I've joined the American Public Health Association, and I would be remiss if I didn't point out to you that you will get one of these before you leave tonight. It's a health administration section for the APHA. I just was recently elected to be chair of the health administration section for this year. But I joined the APHA early on as a doctoral student, and I found it to be really interesting from my perspective, being a healthcare person from a health systems perspective, that there really was a lot of information to be shared. It's some of the best conferences that I've gone to in recent times have been through the APHA. So I've invested a lot of my personal time in trying to advance the health administration section there. Been on the governing council for a number of years for APHA, but again, most recently taking over as the chair. So I think help really develop people's interests and knowledge beyond just being a health system, but really looking at how we are a participant in delivering good public health to our communities. So we're not the center of the universe, as some people might like to think, but actually we're just part of a continuum of care that exists throughout a number of different agencies and networks, and we really need to look at how we best integrate those services. And again, that's where I think, my experience through the doctoral training that I've gotten and being able to, again, I did that all part-time while I was working full-time, was to be able to take that back and actually apply it. So when my current job became available 2 years ago, it was brand new to the health system, and I was the person they came to for that, partly because, again, my experience from ambulatory, but also the fact that I do have this sort of public health experience, the rigor and the training to look at things objectively and scientifically, and to, again, sort of look at the future of where healthcare is going and how we need to transition the system. So I would just leave it that, the more you can get involved in your organizations, I think is a great thing, as many people have said, to help just broaden your experience. I can answer it maybe with some of the questions later, but I think one of the things that I look for in people that come to work for me or that I work with is that they be what I call general specialists. So you need to have a core area that you're focused in, whatever it might be, but I look for people that aren't just an inch deep and a mile wide, and I don't look for somebody that's a mile deep and an inch wide. I look for somebody that's got a good balance, that really understands a lot of the component parts. And I think the DRPH program really opened my eyes to a lot of things that I never thought of before.
Hello, everyone. I am very, very pleased to be here with you. My advisor's here. Hi, Janice. I literally have not seen her in almost 5 years, so it's very, very good to see her. I am incredibly excited to be here today, and when Mary Sewell invited me to take part in this forum, I said, I think I've got some things that I've learned and some things that are valuable enough to share. So yeah, got a pretty crazy schedule, but she actually hit me up at the right time, so thank you very much again for that. Like everyone else here, I think I have an interesting story with how I actually got to where I am today, both in terms of my recognition, if you will, of my interest in public health and more specifically in health policy, and how I actually got to my position. It was really very, very organic. I realized between college and when I started graduate school, 5-year period, that all of the positions that I'd had, there were actually 3, all had some relationship to health, not to medical practice, but to public health. And I've always had a very, very strong interest in politics. I realized for a number of reasons that politics isn't necessarily where I wanted to go. Didn't think I actually had the stomach for it or the patience for it in a lot of ways. And working for the Congressional Black Caucus Foundation, I'm very clear that that was actually a very, very good call on my part, and I'll talk about that more in a minute. And so health policy really became the hybrid for me. And I said, you know what, I think this actually makes a lot of sense. And at the time, I was working for Helen Keller International in New York, and there are a number of people there who actually were Hopkins babies, as I call them, including the president, who actually used to be the dean of the school, Karen Davis, many, many years ago. And I talked to them about my interest, and they said, you need to go get your degree in public health, you need to get a PhD, and you need to get it at Hopkins. 1, 2, and 3, just like that. I said, well, there are other schools, you need to go to Hopkins. Okay. Well, I see they also have master, you need to get your PhD. Okay. Well, why is that? And they said to me point blank, especially at that time, and this was in the mid-90s, there was, from their perspective, a real dearth of people, and especially minorities, ethnic and racial minorities, who were really interested and committed to health policy. very specifically. And they thought that I should go right on in there and throw my hat in the ring. I said, okay. I started the program, and within a year, I actually started working. And as many of the folks here have mentioned, it worked for me. It meant that I was on what I call the extended program. Didn't work out very well for my parents' blood pressure, made them very, very, very nervous. They were like, are you really going to finish this program? And I said, I'm going to finish. But the reality is that the work experience that I got really complemented very well the education that I also got. And for me, it really worked out, really, really well. So I was actually able to work at the Center for Adolescent Health, which is here at Hopkins. I certainly hope it's still here. It used to be headed by Dr. Cheryl Alexander. She actually had started it. Sadly, many years ago, she passed away from ocular melanoma, so she's no longer with us. But the experience that I got there, especially doing a lot of qualitative research and a lot of community-based work, was absolutely just really invaluable. Subsequent to that, I actually worked for an organization called CARTA, the Center for Applied Research and Technical Assistance, which is here in Baltimore, also started by two former Hopkins alums, actually. And, I don't know, maybe there's a trend here, but it's a little disturbing. Barbara Sugland, who is, again, an alum from the school, also passed away actually just a year ago of triple-negative breast cancer. So very, very unfortunate. But again, the legacy with teaching us and the young people who were there, a small group of people, about applied research, about really doing some really serious community-based participatory research was really, really invaluable. And by the time I finished, I left CARTA shortly thereafter and actually, interestingly enough, started working for Montgomery County Public Schools. Very interesting situation. I was actually doing evaluation work on a lot of the new education policies that they were implementing at the school. The connection for me, of course, was having worked at CARTA, having worked at the Center for Adolescent Health, youth development was a very, very strong interest for me and was something that I actually got, very, very quickly. They actually liked the fact that I was bringing in a different background than a traditional education background over at Montgomery County. And so being able to do that work and to, just really kind of come in with a different lens on, to sort of evaluate a lot of the policies that they were putting into place was something that was very, very rewarding. Very unexpectedly, I found out about the position at CBCF, at the Congressional Black Caucus Foundation, and really had to think hard about whether or not I was ready to do that leap. What really drew me to that position, though, was the ability to be able to marry a number of interests for me. So on the one hand, starting to get more into, back into, I should say, the policy world, especially at the federal level. Bringing in my research hat, being able to work with providers, potentially, and with the general public to try to bring these groups together, if you will, to be able to both define solutions and start to implement some real, hopefully, some really good, solid solutions, especially for the African American community. As you can figure, of course, by the name of the organization, they do focus pretty exclusively on African American issues, which does not mean that we do not partner, of course, with other ethnic and racial groups in addressing some of the issues that we focus on, but the key work really is around African Americans. That in and of itself was a big switch for me because prior to that, I really had a focus on a broader group of people. What's been very interesting, I think, and very, very enlightening, more so than anything else, with the work that I've been doing at the foundation, and I should mention that our work actually focuses on education, economic development, and health. So I actually oversee all the program work that we do in all of these areas. My background in health and social policy, because that was my concentration, has been very invaluable. So I don't look exclusively at the health piece. Social determinants of health absolutely matter. Understanding the impact of health on all the other areas, the impact of the other areas on health has been absolutely invaluable. And one of the things that I came to realize, probably more so than at any other time, is the extent to which for people who are not focused on health, health really is a different realm. It absolutely is about people's well-being, and it's about insurance, and it's about people going to the doctor and how they take care or don't take care of themselves. But it's still very much seen as being very separate from the rest of people's lives, really, for the most part. And my ability to be able to help people to change that mindset and to really sort of reconfigure, if you will, their understanding of health has been very, very instrumental, I think, for the organization and for some of the work that we were doing throughout and at the community level. One of the things that I really learned, though, is, and this is a big lesson, to all of you, and I'll be more than happy to talk with you more about this later, is that you are definitely at an institution where you are learning some serious stuff. You're really getting some knowledge here. You need to take it with you. You need to be proud of it. You need to understand what it is. When you go and work with legislators, this is certainly at the federal level, but I believe it's also true at the state and local level. Don't assume that because you have that knowledge, you're going to be welcomed with open arms. Don't think that it's going to be like, oh my goodness, thank you so much, I was waiting for this information. What I've actually seen, I have to admit, I've been very lucky, knock on wood, it hasn't happened to me, but I've seen it happen to a lot of other researchers. They have gone to folks at the federal level and said, I've been doing this research, this is, what you need to be focusing on, you need to consider this issue, this is going to be a barrier to what you're doing, et cetera, et cetera. And literally what they get is, who are you again? Who do you work for? We're fully aware of this. We have people here who look at this. We have our agenda. Thank you very much for this information. We'll let you know if we need you. And you want to talk about one big, fat, ego-deflating session. And it's something that, I'm not going to lie to you, I've seen it happen very, very consistently. So you need to be very clear on what it is that you know, but you need to be very strategic about how you go in with that information, who you tap into. I would definitely recommend that you find out who the key legislative directors are for the members that you might be interested in working with, finding out what kind of issues they're interested in, what kind of slant, if you will, they are using, and looking at the information that they're looking at and gathering what it is they're gathering, and figure out a way how to get in there. Unless you've got a real solid connection, like an inroad, you're going to have to be very strategic about how it is you go in. There is no doubt that there is a very clear role that researchers have to play in the policymaking process, but how you go about doing it might not be as straightforward as what you might think. So that's probably the biggest lesson that I would impart.
Thank you all. That was great. So as you probably heard from the panelists, there's a real diversity of experience, which is very intentional on our part. So now the floor is yours. Please ask any questions that you have for the next 20 or 30 minutes, and we'll break for cocktails. So who's first?
We can start picking people.
Yeah. There's a lot of teachers in this room.
My question goes to Cyrus, engineer. I want to know, how did you get into the WHO? And in your opinion, what elements were pivotal in getting you into the WHO?
Can everyone hear? Did everyone hear the question? Okay.
I guess just to be sure, you're asking my path or in how I got into WHO, and also what prepared you. Is that fair? I mean.
Yes. Maybe what prepared you, what contacts helped you to get in?
Oh, okay. Wonderful. So, actually, as I mentioned earlier, that networking is an important element. Like some of my colleagues mentioned, I've never really applied for a job as in a job that is on the website. All along through my career, it has been opportunities that have come my way, and the job has been posted later on. So this was a similar experience where we were collaborating on a piece of work with some people at WHO, and there was this opportunity that came up because they wanted somebody who had a training in methods and communications, health behavior, to be able to run a global campaign. And so we got discussing about the project and how it might shape out, and then at some point in time, I was just emailed and asked if I would be keen to consider a position to come over to relocate to Geneva. So again, it was one of the conferences where a group of experts on quality and safety that I attended in DC, that was on patient safety, where folks had come down from the WHO, and we just got chatting over a cup of tea or coffee, and of course, one thing led to another, and then before you know it, it was a position that was posted. So. Having said that, there was a certain interest in them also working with Hopkins. And so there were advisors and supervisors and folks who also were well connected with Hopkins. Believe me, there's a huge alumnus of Hopkins at WHO. So that also helped to some extent. And the fact that this was just an opportunity to at some point explore. So one of the reasons now I'm back at Hopkins is because they see this as a valuable relationship to continue technical work jointly. So I don't know if that answers, but networking, being it's luck to a certain extent, and good wishes of your advisors, supervisors, and people that you know.
Since I brought it up, I guess I can start. So the difference between the DRPH or another doctoral really wasn't as apparent to me when I began to look at it. I think what caught my eye about the DRPH was the fact that I'm in the business, so to speak, and so I was looking for something that I could take and apply. So I think I've come to learn, and I'm on the DRPH executive committee for the school, that it really is an applied degree from a doctoral perspective. And again, I knew I wanted to have a doctoral degree, and to me this just seemed to be the best fit, that it was really something I could take and then be very translationally oriented in the industry. In terms of working, I mean, there are lots of challenges. It took me 6.5 years to do my DRPH. I was working full-time across the street. I was fortunate to have a boss that was, certainly very supportive of me scheduling myself to take a class, like a meeting, and I was also fortunate it was right across the street, and very fortunate that I had a wife that was supportive as well, because there was a lot of work involved, and my kids loved it because I did homework with them, and I helped them, they helped me. It worked out well. But it's a big commitment to be able to do it. But I think for myself anyway, it really was great to have something. I like tangible things. I like things I can take back and do something with. So it was very nice for me to be in an environment where I could learn such wonderful things. I mean, high-powered kind of things, and then actually take it back and apply it the very next day. So I think that the trade-offs for me were worth it.
I would say I did it a little differently. So I actually I worked that year after I had done my orals, and I did that intentionally so that I would be done with classes. And so, so I worked part-time during the class years, but I worked here part-time for the Center for Health Disparity Solutions. And so I purposely said, I'm going to do this when I don't have to worry about scheduled classes. But I will admit, I was technically in the process of writing my dissertation, and I was lucky. Like I said, my boss was from Hopkins, and I will actually tell you this comment, and I don't think he would have a problem with me telling this. When I got the job, one of the first things I said, I am a doctoral student. I would like to finish sometime in the near future. I don't want to be a student for the rest of my life. And so what can we work out that I can be able to still do that? And he was like, oh, we're all about flexible schedules. So I actually got there, which anybody who knows me who's not a morning person, I actually got there 7:30 in the morning and worked till about 6 so that I could get every other Friday off. And actually one comment he made to me, he said, I'm very committed to finishing this problem, because he actually was ABD here at Hopkins, so he did everything but finish. And he actually told me, he said, I'm very committed to you finishing, because the only thing I regret not doing, and he said clearly it didn't affect my job potential because I'm the Secretary of Health, but he said the only thing I regret not doing was finishing my PhD. So that really stuck. I mean, he is the Secretary of Health for the state of Maryland, and that was he told me his one big regret. So he was very, very good at saying, how's it going? Did you get it done? But I was also very upfront with them from the beginning. When I was interviewing for the job, I told them about it. And so that's how it worked. And it ended up being a really great experience.
I saw other hands over here. Yeah.
So one of the suggestions everyone was making was sort of diversify. And I think
One of the greatest risks of students, I don't think I need it, but okay, of students here at Hopkins is overcommitment. You know, there are only 24 hours in the day, and we should devote a certain percentage of them to sleeping and eating. So how did you as students select what was going to be important to you, and then how do you balance that also now as professionals, selecting what are the opportunities that you pursue? Whitney, you want to take that one?
Yeah, let's say, I think Wendy should take that one.
It's a great question. Well, I had a great quality of life while I was here, but it was very much around the activities of being here. And I think if there's ever a time in your life to do it, you know, to really dive in, it's now. And I think so. It became more clear as I went forward in the program about what not to do, because I had a lot of guidance from my advisor in saying, if it's not related to your dissertation, I think you know, then don't do it, because that's your ticket out of here. But it was more of that in between, that time in between class, when you finish classes and you're not doing your dissertation, where you kind of feel like you're a kid in a candy store. And so I think probably, you know, thinking about maybe 1 or 2 projects would be reasonable, because there's a lot that can come out of 1 or 2 projects, I mean, as I learned. And I think it is important to not get overcommitted, because you don't want to not be able to deliver, you know, for yourself and for the people you're working with, and because you're going to be giving them an impression, and that's going to be a lasting impression that they'll write about in your letters of recommendation. So I think that limiting, you know, what you do is a good thing, and just being, you know, for me, it was like I really wanted it to be related to child health, maternal and child health. So that, you know, that kind of whittled it down. In terms of how do I do that now, it's a major juggling act. But I love it. There's always something new and different. I've gotten comfortable with not being able to get everything done. I've just gotten comfortable with it. And, you know, and that, you know, some papers may not get published and some grants may not get submitted. And I think probably what I've been able to do is just prioritize. What are the things that are the most important to me? What are the grants that I really want to write? What are the papers I really want to write? I really want to mentor this student and get them through this process. So really just knowing what your priorities are and sticking with them, and then feeling okay about letting go of the rest of it. Because, you know, not only are you balancing different roles when you're in academics, you're also then, for me at least, I'm balancing a life outside of work. So, and that, you know, that is important to do. If you're going to study quality of life, you got to have one too. So.
I'd just like to add that I think it's important to think about those things in terms of the experience that you get out of them as well, because, you know, there's a lot of things you can become involved in, but if when I think back over the number of things I do, is it because I like it, because I'm giving back? So I'm on the board of the Boy Scouts, so, you know, I do a lot of community activities for them, but it's a way for me to give back. I definitely pick things that I like to do, that gives me sort of a break from everything else. So Sarah mentioned that I'm a pilot. I like to fly. I'm a flight instructor, so I teach other people to fly. That's kind of my release. So I think you have to look at it and balance, well, what are the experiences that I gain from it? And if it's something new, I would say do it, because it may come back to help you at some point. But also then balance it against those other things that help you just have the life outside of, you know, your job or school, whatever.
So the professors on this panel mentioned their decisions to take a postdoc and to not take a postdoc. Could you, both of you, please expand on some of the pros and cons that you weighed before making that decision?
You want to go first, Lydia?
So let me clear. I actually applied. So I applied for several postdocs. One that was highly coveted. I was a finalist and didn't get. If I had gotten it, I would have done it. So I should put that out there. And it was the Robert Wood Johnson Health and Society Scholars. I would have done it and gone to Michigan if I had gotten it, but I didn't get it. The second one was in New York City, which was great, and it would have been great. And actually, talking about networking and still working, so on the side, so I interviewed, got the postdoc, and then was like, yeah, I can't live on $37,000 a year in New York City, even though I'm from New York City and my family's in New York City, and I still couldn't do it. But kept the connection with the person who was doing the postdoc, and I actually am now working with her beside, on the side. So it actually worked out well for her and for me because, she's still getting my skill set because she's an MD. And one of the things I want to expand more, but one of the things I do want to mention on what Marjorie said was being here at Hopkins, you have a skill set that you don't even realize you have. And one of the things that Sarah had asked us to talk about was classes we wish we had taken that we didn't take, or classes we did. So I did something kind of very different from HPM. Like Cyrus said, I took a whole bunch of biostats courses, which were painful. But I forced myself to take them because it's a skill that I thought, I do neighborhood work, and so it ends up being somewhat higher level that you need to do these fairly sophisticated stats that still blow my mind. But it actually was one of the best skills because one of the things that helps me now with this person was she's an MD, she's a clinician, she's nobody on her staff that can really do stats the way I can do stats. And so she's like, all I want you to do is write papers. She gave me the data, she said, just write papers. Don't work for her. I'm at a different school, but because I have the skill set that she doesn't have where she is, it actually works in both of our favors. So the reason why I didn't take the postdoc was because, like I said, I just couldn't live on $37,000 a year in New York City. And I was actually also, too, on the non-joking side, I was really excited about this whole CUNY experience. It's a teaching university that's trying to move to a research university. It's in transition. It's a little difficult. My parents are both kind of alumni of CUNY systems. And so for me, it was almost kind of what you're saying, giving back to a population that doesn't always necessarily able to get some different skills and are not normally researchers. So I was really excited for me to work with, that population in New York. And so that was kind of almost my giving back in a way, and not exactly, but that kind of idea. So, Whitney.
So for me, it really wasn't much of a decision. I mean, full disclosure, I did apply for faculty jobs straight out. So I also was sort of trying to figure out between postdocs and faculty jobs. For me, I did my PhD in 3 years, and I really don't recommend doing that, by the way. But I really needed more time. I felt like I needed more training. I needed time to really synthesize and get my papers in shape for publication. I also wanted to get ready for my job talk and really have that solid. And I didn't feel like where I was coming out, having done the program fairly quickly, that I was ready. So for me, it was a pretty straightforward decision. I think there are definitely pros and cons. I think I was probably more ready than I thought. Coming out of the program, I think that you guys have amazing training. As everybody has mentioned, give yourselves a lot of credit, and toot your own horn. I mean, you guys are really, you need to do that when you get out there. So I think that was part of it too, is that I didn't realize that I was probably more ready, but I needed that extra time, and I'm in the end glad that I ended up taking it.
Can I just make one comment? I don't ever think a postdoc is a bad idea. So I'm just going to throw that out there that actually there's a fellow student here who I was here, and she called me up and said, what should I do? And I'm like, take the postdoc if you get a good one. Take it. Because it really is some really nice free time to do your own work, to get things published, where you start with faculty. I was teaching from day one. I started my technical start date was September 1st. I started teaching August 31st. So just so that, I mean, no matter where you are, you're going to, most likely, except maybe here, you're going to be teaching off the bat. And so just think about that. So I actually think postdocs are very good ideas.
The other thing, too, about a postdoc is I would consider going to a place that's very different than here. That was very valuable to me. I went, I was trained in a school of public health, and I went to a school of medicine. Very different. But it was hard. It was a hard transition, but it made me a better researcher because it really forced me to think about how is my research clinically applicable? Why is it important? Why should I, be doing this? It's not just an intellectual exercise. And I worked with a lot of physicians, and it really helped strengthen my research a lot in thinking about the applicability of it.
One thing I would also like to mention, I could not agree more that the value of a postdoc is incredibly important, especially if you want to go into academia and for a number of other arenas. I would also encourage you, though, if you are interested potentially in working with community-based organizations or working directly with local organizations, directly working with populations, honing your skills in that arena will also be very, very valuable to you. You probably have heard this. If you haven't, you probably will hear it at some point. A lot of the writing that we do here, whether it's based on primary, secondary research, policy analysis, what have you, for much of the general population is like, I don't know what you're talking about, literally. And ultimately, a lot of the folks that you probably want to touch with the work that you want to do are those folks. You may not want to try to go directly to them, but ultimately you're trying to get to them. So your ability to be able to take the work that you do and to write it for different audiences, including really for a fairly lay population, will be incredibly valuable, because I promise you there are a lot of people whose job it is to do that work, who get paid to do that work, and who do it very crappily. And the reality is people sit there and just look at the stuff and just go, what the hell? And literally their sense of isolation, if you will, from researchers, and we're talking about from people who by and large are committed to doing work, doing research to help to benefit them, is about like this wide, right? So in addition to doing a traditional postdoc, going towards that route, if you could also, if it's an interest, if it's not an interest, leave it alone, obviously. But if it's an interest, I would strongly encourage you to pursue doing that kind of writing as well, because it's incredibly valuable, and I think it'll really, really serve you well. Once again, to be able to take the work that you do and to be able to share it, really actively with different populations.
You had a question.
Yeah, my question for Mark Biddle. You mentioned that one of the trends in healthcare management is for people to be trained more on the business perspective versus the healthcare perspective. So do you think that the MPH degree is sufficient for someone who wants to work in healthcare management? And what do you think someone should focus on during their time in an MPH degree if they want to work in healthcare management?
So I think that public health has become much more of a relevant degree in healthcare, in the industry, of healthcare, probably in the last 5 years, and certainly going forward when you look at all the discussion around healthcare reform, this notion of, how do we focus on populations and communities, things that, an MHA program never talked about. It was always about how do you run a hospital. So I think having an MPH is certainly, as I look at people who are applying for positions or participating in some review process, if they have an MPH, I think it's a real benefit to them. To those who are, and I teach in the MPH MBA group for organizational behavior, but to combine the MPH and the MBA is, I think, the ideal way to go. But if you had the ability to take some electives in accounting, in finance, things like that related to just sort of enhance the MPH, I think an MPH is going to be a pretty viable degree in healthcare. Is that a bad thing or not?
Oh, not necessarily something the MHA program works.
Yeah. No, I'm not saying that the MHA isn't bad or the MBA. I think the healthcare industry has evolved a lot since I've been involved with it, to the point where MBAs tend to be more prevalent than the MHA or that used to be. But I think you're seeing more MPH students now coming into the field.
So If I could ask one final question, I want to touch on two themes. One is the art of negotiation, and the second one is mentorship. So maybe, Joanna, if you want to talk about for you how mentorship helped, what you expected, how it worked for you, either on your job market experience or through the dissertation process. And then Mark, if you can talk about being on the side of someone who's hiring in the art of negotiation, sort of what's a turnoff when someone's negotiating a position with you. And then if Lydia, if you can talk about being on the side of negotiating something, sort of what worked, what didn't work. So Joanna, why don't we start with you?
I can't overstate the importance of really knowing and liking your advisor. I can't. My advisor set a path out for me, and it was, while I may not have agreed with every single decision he made and made for me, I don't question the wisdom of what he did at all. I met him at the end of my MPH program. I worked for him for 2 years. It got me in the door enough for him to recommend me to do the PhD. I don't think I would have gotten in, frankly, without it. And he introduced me to the key players that I needed to know for my dissertation. He introduced me to my former boss at USDA. And something I was going to mention, someone asked a question about different opportunities. I did a lot of TAing, a lot of TAing. And while it was painful at times, and I TA'd for several people in the room now, it was painful at times. It was one of the more valuable experiences because you meet students who come to you for advice, and you don't generally get to do that in a lot of situations. And you become a mentor to students, and that made me. And again, there's discussion about what you want to go into. I haven't ruled out academia at all. Government is an interesting diversion, and it's good for what I'm doing right now. And I shouldn't say diversion. It's really we get you. It's perfect for what I'm interested in right now. The hours are good. The pay is steady. I really enjoy what I'm doing, and I'm working with a lot of interesting people. But I haven't ruled anything out, and that's sort of the thing that, again, my mentors encouraged me to think about, was that no path necessarily needs to close just because you start down one path. And I did, and again, speaking of working, intern if you can, even if you don't get paid intern, particularly, and Lydia did this obviously full time, but I interned for the summer in between different years of my dissertation at Department of Agriculture, which again, probably got me the job at Department of Agriculture when I started full time looking for jobs. I met the key players. I got to know what the policies were. I got to understand what the political implications were of what we were doing. And I brought a perspective that wasn't really there aside from, frankly, my former boss, which is public health. People, a lot of the time, aren't thinking about the implications of public health and what happens in government and what happens in the rest of the world. And people really started to value my opinion on how I thought food safety should be conducted. And so I would get to know your advisor. I would intern as much as possible, even if you don't get paid for it. I would definitely be a teaching assistant. I would be a research assistant if you can here. Again, it's finding, and again, as Whitney said, I would focus though. I would not say, oh, someone needs a TA in biostats, but I really have no particular interest in going towards biostats. Don't do it then. I mean, it's too much time, and it won't necessarily, it might help you with biostats, but for other things it may not. So focus your efforts and really maintain relationships, and don't burn any bridges if you can help it. I mean, I know people who have done that, and it definitely comes back to haunt them. So keep your relationships open and make sure that you take all the opportunities that are presented to you.
So do you want to repeat the?
Yeah, so if you could talk a bit about, on someone who's on the hiring end now, if you're negotiating a job with someone, sort of what are some of the do's and don'ts of negotiating a job package?
Negotiating job. Okay. So actually, I wrote down sort of 10 things that I look for when I interview someone. I think there's been a lot of emphasis, and there always has been emphasis on, making sure you identify all your accomplishments, all the things you were able to do. But, most of those are situationally dependent. You're able to accomplish them because of certain variables or situations. So I think what I look for when I'm interviewing someone, it's not just what accomplishments they have. I certainly don't look at their GPA and that kind of stuff. I know some people who do, but I personally don't do that. I do look at, whether or not they have pushed themselves, so let me just read through these. So one, I'm looking to see whether or not they've been true to a certain set of values. So can they express what it is that's important to them, and can I demonstrate or see demonstrated through their resume or through their discussions with me how they've lived up to those values? I've walked away from jobs because I was asked to do things that I didn't believe in, and it was, certainly not economically a good decision, but it was just not something that I could live with. And so when people look at my resume and say, well, what happened from here to here, I tell them, I left, and here's why. So I look for people that, really stick to their values. And you can think about these in the negative then in terms of what sort of would turn me off about somebody. That they have a general plan in mind. I think you've heard through every one of our discussions of our careers that none of it was a straight line. That everything that we did, whether it was luck to get into WHO or the fact that my first job was just happened to coincide with the retirement of the manager, and he was willing to delay that. I mean, it's all about being prepared and looking for the opportunities and being willing to take those opportunities. So I think everybody has to have a general plan in mind, but be willing to take detours. And we all don't drive home the same way every night because there's always something in the way. So I think we need to, I look for people who are willing to take a step back in order to take 2 steps forward. That's important. I mentioned about being a general specialist. I think it's important to have a specialty to be able to show that you're able to do certain things. So if you're applying for a manager job, how well do you work with and direct other people? But I think you also have to have a broad knowledge of other things as well. Are you self-confident? And I don't mean overconfident. I've flown with a lot of overconfident pilots, and that scares me. But I do look for people who are self-confident, who are willing to try something outside of their comfort zone and can show me on their resume that they've done things that were sort of outside of their comfort zone. I'm not really good at raising money. I'm not a good fundraiser, so I don't put myself into those positions often. But certainly if I can be able to point to things that I've done throughout my career to just give me that experience. If you've ever put together an APHA or if you ever organized a program, I mean, there's a lot of work that goes into that. It's all volunteer, but it's great experience. So, have people put themselves out there to really, break out of their comfort zone. Never, ever stop learning. So I'm always looking at how people sort of continue to advance their knowledge. Of course, we all have doctorates. People get their doctorate and you say, okay, well, what's next? But I read and I go to conferences and I'm constantly trying to keep current on what's happening. And I look for people to, provide me evidence that they're doing the same thing. I wrote a quote down here. It says, the recipe for perpetual ignorance is be satisfied with your opinions and content with your knowledge. So again, I think people have to be able to demonstrate that they're continuing to keep themselves fresh. I also look for people to be critical of themselves. So it's easy to say all the great things that you do, but I want to know what you didn't do right and what did you learn from it. So I think I'm my biggest fan, but I'm also my biggest critic. Probably harsher than my own boss when it comes to my self-evaluations. But I think that's important for people to be able to demonstrate that they're willing to self-evaluate their performance and willing to be critical and willing to change as a result of it. We all make mistakes. The question is, did we learn from them? Volunteer, we've heard it a number of times, get involved. Show me that you've done things not only within your particular specialty or area of interest, but what do you do outside of that? Do you volunteer with Girl Scouts? Do you, help in the community? What do you do outside of what you do every day? Be a leader. Doesn't matter what position people are applying for. I have interviewed housekeepers. I've interviewed administrative assistants. I've interviewed senior directors of patient accounting. Some of those are clearly leadership positions, management positions. Some of those clearly aren't. But I look for people who can motivate other people. So no matter what it is, everybody, in my opinion, is a leader. And they need to be able to work with other people, motivate other people. So what have they done to sort of demonstrate leadership, regardless of the kind of role they were in? I do a lot of talks at high schools, middle schools about careers and healthcare. And somebody asked me a question one time, said, what's the worst thing about your job? What's the one thing you don't like about your job? And I said, given the industry that I'm in, I said, the one thing that I don't like is working with people who don't care. And unfortunately, I run into a lot of people who just don't seem to care. And so I look for people who have demonstrated an ability to, one, show they care, and two, avoid people who don't care. And then the final thing is, don't be a slave to your job. I said it earlier, I've walked away from jobs because of things just didn't feel right. And so if they don't feel right, I look at people's career paths and said, did you ever come up to a situation that was bad, and how did you handle it in terms of, walking away? And I think back to rule number 1, again, stick to your values. So hopefully that answers something.
Very helpful. Sorry.
these are golden words, by the way, and now I know why Hopkins has the best, because when I interviewed for a position as a resident in human resources, all of my interview, believe me, all of my interview was not about what I knew about and the knowledge, but it was more about, tell me a little bit about yourself, and it was about the chemistry. And it was about the attitude. And so after I got the job, and after I saw the VP interview in the same fashion many other positions, because as an intern I could shadow her. So I asked her, but you don't ask people about their knowledge or the content. So, one of the things that she said and educated me, that's a technique called behavioral interviewing. And something that still sticks in my mind, you hire for attitude and train for skill, but you cannot do it the other way around.
So, the whole negotiating thing, I don't necessarily know if I did it right. I did it okay. It's one of those things that you never know kind of how it happens until you learn later on. So I actually became friendly with a cohort of women who came in to the faculty position the same time I did, all in different departments, none of them in my department. And of the 5 of us, I would say that I did the second best. I have one psychologist that she did well. We kind of talk about like, whoa, she negotiated well. I was lucky. I was a little lucky that because I had other positions, in a way I was able to, what's the word I'm looking for?
Leverage.
Pit them against each other. I know it's horrible, but I was. Yeah. So, I had 4 jobs, and so I was saying, so-and-so's offering me this, and, basically, and actually I was lucky because it was in the same system. The dean knew, and he was like, okay, so I see so-and-so and so-and-so offered you this, so we're going to offer you this. And so it worked out that way. I think, actually Sarah got many calls from me because I didn't know anything about it. And between Sarah and my advisor, I'd call and say, okay, what do I ask for? What does this mean? What's this? And actually, my advisor and Sarah gave me really good advice. And actually, Keisha Pollack, who's not here, also gave me some interesting advice. She said, it didn't happen, but she said I had a colleague who didn't talk about furniture, and there was no furniture in their office when they walked in, and because they hadn't negotiated furniture. And I was like, I didn't know furniture was something you negotiated. She's like, I didn't know either until that happened to that person. It didn't happen to me that way, but I surely did ask the question to make sure that there was furniture in the office. Because you don't know this stuff until you talk to other people. Who would have thought negotiating furniture? Like I said, I didn't have to do it, but it was a really good point that she made to me because it's stuff that you don't think about. And like I said, Sarah and my advisor really told me about like different things, like, academia-wise too. There's a 9-month salary compared to a 12-month salary compared to course release, and what does that mean, and how much does it cost, and all this stuff that I had never heard about. And so I just called the people I know, and the people I know who do this, and I said, does this sound good? Does this make sense to you? Is this kind of the norm? You can also look up kind of what's the median or the mean, Hopkins students shall know that, the median or the mean kind of salary within a system. And actually, something I found out after I got the job is, for example, the National Education Association actually publishes especially for state and city. I'm in a CU university, Whitney's in a state university, but state and city universities have to publish their average median salaries. So it is published. Which is something I wish I knew beforehand, but we won't talk about that. So, but it's there. So if you wanted to find it, you could find it. And that's also a negotiating technique that you can use. And I would say, also, one of the things that Whitney said about TAing, and Joanna said, one of the things I didn't realize that was kind of my strength was that I had TA'd at 3 different levels. So I had TA'd at undergrad, grad, and doctoral, and didn't realize what an asset that was until after I got there. And I was like, oh, I should have used that more. Because my particular department, which is community health education, actually has an undergrad program. So I teach at the undergrad, master's, and doctoral level. And for them, I was a big asset because they didn't have anybody who could teach at the undergrad level. And I had already taught at the undergrad level because I had TA'd Dr. Luis's class for 4 years, literally. So just, I would just say, think about what you have as assets and talk to other people. I mean, you have other people in this room. I know Ellen McKenzie has been wonderful as your chair. Like, talk to your professors and say, how does this sound? Should I be too tough? Like, Dr. Luis told me, he's like, you got to let that go. There was something he was like, you just have to let that go. And I was like, okay. And then, but he's like, but you could ask about this. ask about some other perk here, and it ended up working out. But it was a little difficult because I've never done it before, and I didn't know what to expect, especially in academia. And so definitely call on your resources and ask them kind of, Sarah had just done it like a year and a half, so it was easy. Like she was in her car, and I was calling, like, Sarah, what do I have to do? I have to give him an answer now. And she was like, calm down, don't worry about it. Here's what you have to think about. So call us. You can call me. You can email me. I'll tell you whatever I know.
So in the interest of giving you guys a chance to talk to everyone personally, I want to stop. But before we break, I want to give a special thanks to several people who made this event possible in addition to our panelists. Our department chair, Ellen McKinsey. Philippa Moore, who's the director of alumni relations. And Mary Sewell and Judy Holzer, who run the academic office in HCM. And please join me in giving a very warm thank you to our panelists, several of which have traveled far to be here tonight.